Welcome to Portal to Health, using the patient portal to support chronic conditions microlearning series, brought to you by the California Telehealth Resource Center. This kicks off session 3, staff training. Before we begin, we want to note that this session is purely for informational purposes. CTRC has no relevant financial interest or arrangement with any organizations related to commercial products or services discussed during this webinar series.
The California Telehealth Resource Center, or CTRC, was established in 2006 to share unbiased, no-cost digital health resources and consultative support services with providers and patients located across all 58 California counties and beyond. As part of a collaboration of 12 regional and 2 national telehealth resource centers, CTRC is committed to implementing digital health programs for rural and underserved communities. CTRC became part of OCHIN in 2017 and together reflect 25 years of practice-based solutions expertise. OCHIN supports safety net health organizations that serves over 6 million patients in 49 states. The OCHIN Health Center Controlled Network, or HCCN, is the largest HCCN in the nation. Health Center Controlled Networks are collaborative groups that provide no-cost, on-demand resources and training to participating health centers to address operational and clinical challenges related to health information technology, very much akin to CTRC and other telehealth resource networks. OCHIN HCCN supports over 100 participating health centers right now, using a variety of electronic health records and serving over 4 million patients, and it is funded by HRSA. We welcome you to check out the OCHIN HCCN webpage to learn more.
And then there's us. I'm Lula Gonzalez, and I am a learning content designer, just like Angie Brown, my wonderful colleague. And before we jump in, here's a list of all the microlearnings in this series. Each session is designed to deliver quick learning on a specific focus that can be applied to your patient portal and disease management strategies. These sessions can be viewed in order for a comprehensive overview or as needed for targeted learning. And with that, welcome to Microlearning 3, Staff Training. In this session, we will cover staff training strategies that will help drive patient portal adoption and efficiency.
All right, so let's do this. Before we can effectively train staff or help patients use the portal, we need to ask ourselves, how well do we actually know our portal? Understanding the ins and outs of the system will make a huge difference in how smoothly it gets integrated into your daily workflows. So, what are your most used functions? Every clinic is different, so take this first step to identify which portal features are being used in your setting. Is it secure messaging, appointment scheduling, or viewing lab results? Knowing this helps prioritize where to focus training efforts and which workflows need the most attention. And then where do patients run into the most issues? Think about the common complaints or questions you hear from patients. Are they struggling to log in all the time or navigate the portal or understand how to view their test results? Getting to know these pain points allows you to proactively address them during the patient onboarding phase or through support materials. And where do staff run into the most issues? It's not just about the patients. Staff encounter barriers too. Are there delays in message triage? Is there confusion about handling proxy accounts? Or maybe your process for releasing sensitive test results is a little bit murky? By recognizing where staff experience friction, we can fine-tune internal workflows and training. Training staff to use the patient portal isn't that different from rolling out an EHR system. It's not just about clicking buttons, it's about understanding how the portal fits into the larger care delivery process. So first we have to learn the system. Staff should explore the portal on their own because we know that hands-on experience builds confidence. And what does it look like from the patient side? How are messages, appointment requests, or uploaded documents handled? And when it comes to training, it shouldn't just cover how to use the portal. It should also address how to troubleshoot common issues, explain features to patients, and really blending portal use into daily routines. To do this, consider role-playing patient interactions or walking through real-life scenarios during training sessions. And then finally, it's obvious, but practice makes better. Encourage staff to use the portal regularly, both in training environments and in real life scenarios. The more familiar they become, the more seamlessly it will be integrated into patient care. So, when we think about integrating the patient portal into our daily operations, it's good to design workflows that are centered around both patient needs and staff needs. This means that we're not just adding technology for the sake of it, we're using it to improve patient care and streamline communication. So, when we think about enrollment, first we need to clear workflows for enrolling both new and existing patients. This could include identifying who helps patients get signed up, whether it's front desk staff during check-in or medical assistants during rooming, and ensuring patients understand the benefits of using the portal. For existing patients, think about how you can promote enrollment during follow-ups or through outreach campaigns. And then patient messaging. Messaging is a powerful tool, but it certainly needs structure. Who's responsible for reviewing incoming messages? Is there a protocol for triaging clinical versus administrative questions? You want to make sure that messages are routed correctly and that patients know when to expect a response. So, is that 24 hours or 48 hours from then? And then proxy account setup. Proxy accounts are critical for caregivers, parents, or legal guardians managing someone else's care. We should have standardized processes for verifying consent and setting up these accounts, especially when dealing with sensitive health information or transitioning minors to adult access. Clinical workflows. So, clinically, the portal is used for things like refill requests, medical questions, and test results. It's important to define how these requests are managed. For example, how quickly are refill requests processed? Who handles patient questions, and how do we ensure sensitive results are delivered with the appropriate context or follow-up? And then lastly, administrative workflows. Administrative workflows include appointment requests, billing questions, and insurance updates. So setting clear expectations for how these are processed makes it so that both staff and patients are on the same page. For instance, if a patient requests an appointment through the portal, do they get a confirmation call or a message through a specific time frame?
Yes, and scripting can easily fit into workflows. They can reinforce desired organization norms and create uniform messaging. So concentrate on key roles at first, including call center, front desk, and clinical support staff. Call centers often field questions about scheduling, non-urgent questions, and medication refills, all topics that feed into the patient portal. When a new patient reaches the call center and requests an appointment, the operator can offer to send them an activation link so that they can easily recall the appointment time and date. This may sound like, "We look forward to seeing you on the 27th. Would you like me to send you an activation link to get started with our patient portal? You can fill out forms, check in with your visit, and access your after visit summary anytime." For front desk and clinical support staff, their face-to-face interactions with patients really make them critical roles. There are several opportunities to use scripts with patients, particularly when discussing provider communication, viewing lab results and test results, and managing future visits. During rooming, clinical support staff may say, "Your immunization schedule and test results from today's visits will be available in the patient portal. I see you haven't signed up yet. We can get you signed up now if you like it." Front desk staff can emphasize tracking future visits upon check-in and check-out. It may sound like, "Thanks for coming in today. Your visit summary will be available on the patient portal. Would you like to sign up before you head out?" And consider those management principles, like including representative staff in the development of those scripts, offering training and practice sessions, and create gentle reminders to use appropriate framing while talking with patients. Some health centers have found success with training staff on two screens. So one screen has the staff view in the EHR, and the other has a test patient's portal account open, which simultaneously displays the back and forth of portal transactions. If possible, enlist two staff members, one to play the role of a patient and another to play themselves, and then switch. Go through sign up, messaging, requesting appointments, medication refills, reviewing visits and medical history, and engaging in telehealth. It's important to remember that providers and staff will be viewed as experts on the portal through the patient's eyes. So they should be comfortable walking patients through essential portal functions from the patient's point of view. This has been identified as a gap often overlooked by implementation teams.
Okay, so once your patient portal rollout is complete, continuously evaluate how well it's working for your patients and staff. Also consider engaging patients through an advisory council, focus groups, or patient satisfaction surveys. Gather data by leveraging your EHR's reporting capabilities to track important things. Sharing portal data with staff may encourage higher adoption rates or sustain strong efforts. You could consider monitoring the number of patients who are enrolling, number of patients actively using the portal, patterns of portal usage, such as tracking which portal features and functions patients are using and not using, demographics of the active users, and then provider use. Remember to recognize and celebrate staff when they meet or exceed portal goals. And since some care teams may have smaller panels than others, consider basing performance in terms of the percentage of successful enrollments versus total opportunities for a day, week, or month. When staff show room for improvement, take the opportunity to ask them if they are comfortable talking with patients about the portal. If not, explore their hesitations, role play possible scenarios, and build confidence and competency. Providing incentives for staff to promote, sign up, and encourage patients to use the portal can be fun and rewarding. Incentives can be given by role, per a set time period, individuals, or to clinic-wide. Consider the following incentive ideas based on your staff's preferences and your available resources. So it could be a small cash bonus, gift card, free lunch, a special parking lot for a certain time, an extra vacation day, a photo on a recognition wall, a pizza or a taco or whatever party, and then maybe even a staff outing.
That sounds fun. I want to be invited. So remember to use your EHR to manage portal-related workflows. Leverage that technology. Use both bulk texting and outreach, messaging automations, instant portal activations, direct scheduling. Also use it for forms and questionnaires, and patient materials and troubleshooting guides are also critical. Contact your EHR vendor to see what functionalities they can support. And with that, we're ready to wrap up with some key takeaways. So we've learned that the patient portal is an effective tool for delivering chronic disease management services. Again, don't let this opportunity go to waste. Effective staff training drives adoption and efficiency. Think of integrating the patient portal like an EHR rollout. Staff should learn the system, train regularly, and practice to build confidence. Proactive workload management prevents burnout. Setting realistic response time expectations and distributing responsibilities across teams really helps us use the portal more effectively.
Okay, so what's next? Microlearning 4, portal facilitators and barriers. So we'll review barriers to adoption, learn to make digital health tools a standard, identify strategies to enhance staff learning and support. And we have a repeat, but cleaner slide to show that again. So we do hope that we see you in Microlearning 4.
And thank you to HRSA for supporting this content. And for ongoing support, make sure to check out our website at caltrc.org, where you can find events, webinars, on-demand resources, and so much more. Or you can also reach out to us directly at caltrc@ochan.org. And finally, don't forget to sign up for CTRC's newsletter. And thank you for joining us. We hope to see you at our next section.